First procedure, verify the healthcare provider's order. Gather the necessary equipment and supplies. Perform hand hygiene. Nurse washing hands thoroughly. Provide patient privacy. Nurse adjusting the curtains or closing the door. Introduce yourself and identify the patient. Nurse smiling at the patient. Before shaving a patient with a disposable razor, review medical history and lab values. Look at patient's facial hair and skin. Raise the bed to a comfortable working height and lower the side rail. Apply clean gloves. Nurse putting on gloves. Test the water to ensure that it is not too hot. Place a washcloth in the basin. Place a bath towel over the patient's chest and shoulders. Wring out the washcloth thoroughly. Apply the warm, moist washcloth over the patient's facial hair for several seconds. Apply a layer of shaving cream. Smooth the cream evenly over the side of the patient's face, over his chin and under his nose. Hold the razor in your dominant hand at a 45-degree angle to the patient's skin. Use your non-dominant hand to gently pull the skin while shaving. Begin by shaving across one side of the patient's face using short downward firm. Check the patient and ask him if he feels comfortable. After patient has been shaved, change the water in the basin and rinse his face thoroughly with another warm, moist washcloth. Dry the face thoroughly and apply aftershave lotion if the patient wishes. Help the patient into a comfortable position. Return the used equipment to its proper place and discard the used equipment. And then lastly, perform hand hygiene. Gather all the necessary equipment. Perform hand hygiene. Provide patient's privacy. Place a bath towel over the patient's chest and shoulders. If necessary, gently comb the patient's mustache or beard. Allow the patient to use a mirror and direct you to the beard or mustache areas to trim with scissors. Use your dominant hand to hold a pair of small scissors as you groom those areas. Inspect the condition of the patient's shaved face. Inspect the skin beneath the beard or mustache. Ask patient if patient feels clean and if he is comfortable. Help the patient into comfortable position. To ensure that the patient's safety, raise the appropriate number of side rails and lower the bed to the lowest position. Dispose of used supplies and equipment. Leave the patient's room tidily. Remove the dispose of gloves, perform hand hygiene, and then document and report the patient's response.